The Biden administration says it's prepared and ready for the go-ahead on coronavirus vaccines for children ages 5 to 11.
We told you yesterday when experts with the FDA endorsed the shot for use in that age group. The official emergency use authorization from the agency is expected anytime.
ABC 17's LEILA Mitchell is live tonight in our newsroom after digging into what parents will need to know. And LEILA, experts say authorization will have a major impact on schools and really the overall vaccination effort.
That's right, Deb. So the White House ordered 28 million vaccines, which means several million children will have the opportunity to be fully vaccinated within the next month, which health experts say is another step towards some sort of normal. However, there are people that are worried about how the COVID-19 vaccine will affect children, while on the other hand, there are some people who are worried about how COVID-19 will affect children. Now listen to what one health expert has to say about these concerns. Millions of kids could become eligible for the Pfizer vaccine as early as next week.
States have now placed their initial orders of vaccine for kids.
Health experts say this next step in the vaccine effort is a step in the right direction. Dr. Laura Morris, family physician with MU Healthcare, say the vaccine's benefits outweigh the risks, including myocarditis, an inflammation of the heart muscle.
Myocarditis is still rare. There were no cases that were seen in the Pfizer safety studies for children aged 5 to 11.
Morris says there is more of a risk if a child contracts COVID-19.
Also at risk for that multi-inflammatory system disorder after having COVID, MIS-C.
Children will receive a smaller dosage of the vaccine.
Pfizer vaccine for an adolescent or an adult is 30 micrograms, and the dose for the younger children aged 5 to 11 is 10 micrograms. The reason for the smaller dose is not children's smaller size. It's actually the fact that their immune system reacts much more strongly.
So how will this next step in the vaccine effort affect schools? Noelle Gilzow, president of a Columbia Teachers Association, says it could be the next step in unmasking in schools.
And our recommendations regarding the masks kind of hinges around the vaccination of that younger population. So I think it's good news.
And it's important to remember that the FDA's recommendation is only for approval over the vaccine. There is no word yet if the FDA will grant emergency use authorizations for the vaccine, but health experts both nationally and locally expect shots to be in arms by the first week of November.
Okay, LEILA, now you touched a little bit on how the kid-sized doses will be smaller than what's currently approved for adults, but have you been able to find out how vaccinators will be able to tell the difference between the two doses? Pretty important there.
Yeah, Deb, so Pfizer says that the packaging for these kids' doses will look different so that medical providers can tell the difference between these doses and doses for children that are, or anyone 12 and older. Now, the shots for 5 to 11-year-olds will have orange caps that will stand out in contrast to Pfizer's purple packaging.
Now, for adult vaccinations, LEILA, we saw like a tiered rollout here. Can we expect something similar for children?
Yeah, so health experts say that children with chronic lung or heart disease or obesity are more at risk for a severe contraction of COVID-19. And Laura Morris says she expects that these children will most likely be prioritized.
Okay, and LEILA, you've been speaking with parents, and any word on how many parents say they actually want their kids to get a vaccine?
Yeah, so according to a recent poll done by the COVID-19 Education Equity Project, 2/3 of parents with children 5 to 11 years old said that they would likely vaccinate their children. And parents that have already received a vaccine are more likely to get their children vaccinated. However, for parents that are not so sure if they want to get their children vaccinated, they say that full FDA approval or a mandate in schools would likely change their mind.
All right. Thank you very much, LEILA Mitchell, for all that information.